My name is Dr. Kayte. I became a doctor after experiencing the onset of severe health issues that puzzled doctors and left me without answers. I started television hosting in an effort to raise awareness about complex chronic illness and spread the information I've learned from niche health experts from all parts of medicine. In my interviews, you will find topics about heavy metals, environmental toxins, emotional causes of illness, struggle and triumph over adversity, silicone injury, hormones, peptides, regenerative medicine, and much more. I'm so grateful to have people come with me on this journey as I learn to heal my body and help others do the same. I'm Dr. Kayte, and I'm very excited today to be here in Mexico in Ciudad, Acuna, right on the border of Del Rio, Texas, with the amazing Dr. Steve Hines. Hi.
Hello.
Thank you. Thank you for being here. So, Dr. Stephen Hines, you are a traditional naturopath. You are a naturopath with a specialty in endocrinology, which is pretty unique.
Yes.
And you have a practice that deals with a lot of complex chronic illness, degenerative processes in the body, sometimes relates to anti-aging. You're an expert in Lyme disease and Babesia and Bartonella and all the L-form bacterias, pathogens. You're an expert in bile.
Zoonotic infections.
Okay. Well, I'm really excited to talk to you about all of these things, and I'd like to get started, just maybe have some background.
Back when I was probably 5 or 6 years old, I had bronchial asthma, and I felt like I was smothering all the time at night and scared a little crud out of me. And my dad was in the military, so I got vaxxed. Every time we moved to a new place, they said, well, do you have your vaccine? And I said, I don't know. Well, let's give them to you again, just in case. So I had tons of shots. And by the time I was a teenager, I had a lot of allergies. And then one day I was maybe 20. I was married, had a new baby, and I was operating a front end loader piece of equipment up in New Mexico. And one day I stepped off my loader and my knee locked up on me. I mean, just wouldn't bend. I thought, oh no, this is not good, So I contacted a friend of mine up in Durango, Colorado, and I said to her, she was part of a little Bible school we had, and I said, I need everybody to pray for my knee because it's something really wrong. I know nothing about medicine at the time. And so I said, everybody pray for me my knee would get well. And so the next day she calls and she says, okay, everybody prayed, but I also talked to my naturopath. I'm thinking, oh, great, you're a naturopath. This is one of those tree-hugging nutcase crazy people. And he said, you need to eat a bundle of raw celery a day. I said, no, Eli, we're broke. New baby, like if 50 cents would have got you around the world, I couldn't have got out of sight, But I did have 19 cents to buy some celery. I said, okay, what do I got to lose? So I'm chumping on celery as I'm operating this big monster heavy front end loader moving dirt. And it did that for 2 days. And then I got off the loader one day to go eat lunch. I met my crew and they said, well, how's your knee? And I thought, well, it didn't lock up. And it didn't lock up for 2 years after that. I thought, well, that is weird. How in the world could celery fix a mechanical problem? I mean, it's popping. It literally would not bend. And so that got me thinking about how in the world could celery? Who would have thunk it? And so this crazy naturopath up in Durango, Colorado, told me how to fix something. And so I spent years. This is before the internet, so I bought every book I could find.
These are all your books.
500-600 books, and trying to find the answer. How did celery fix my knee?
I would regret if I didn't mention that Medical Medium has a whole book now just about celery, which created a viral trend. I don't know if you're familiar with that.
Yeah, that was probably, of course, I've told the story thousands of times for 25 years. So maybe I put celery on the map. I remember when the local grocery stores would see me, they'd say, dude, we can't get enough celery. You still don't have the celery, because every time I did a news interview. And so then later on, I did hear about this, the medical medium guy, and people are saying how great celery is. And I said, yeah, absolutely. I mean, but I understood why. It took me, I actually went into naturopathic school because I had to find out why celery on my knee. Still didn't know, even after naturopathic school. And one day there was a naturopathic physician named Dr. Murray, and he wrote a little piece for enzymatic therapy, I think, celery seed extract. Mm-hmm. And I figured, okay, it's probably got similar properties. And there was a prostaglandin E2 inhibitor, prostaglandin 3 and 4. One's an inhibitor, one's a promoter. But I also found basically that I defy you to eat a bundle of raw celery a day and not drink water. It makes you thirsty.
Okay.
I never had a thirst mechanism my whole life. I never drank water. Didn't think I needed it. I was a double humper camel. I didn't need water. Friends of mine, we go hiking in Colorado. They've been drinking water all day. I didn't drink nothing. But the next day we go to work. They go to work and they're fine. Me, I couldn't even move. And I didn't understand. And so that eventually led me into extreme research into what is dehydration. And we have a gentleman at the clinic that 19 years ago came in. He was a physician. He came in with multiple sclerosis in a wheelchair. And I asked him some questions. You got MS? I said, how do you sleep? He said, I sleep good. And I said, well, that's weird because most MS people don't sleep very well. He said, well, I take Benadryl. I said, oh, okay, so Benadryl is an antihistamine. If you block histamine, you don't move water from the arterioles into the venous capillary bed. You can inhibit that. And so I said, okay, dude, I got an idea. Took him in the other room, had my nurse give him a liter of saline and a half-liter D5W as fast as it would run. 4 hours later, he walked up, got out of his wheelchair, put it up, and carried it out the same day.
What is D5W?
5% glucose water.
The dextrose water.
And so when you're dealing with dehydration, which is a monstrous issue, when you're using saline is extracellular fluid. In order to hydrate the intracellular, you need free water without osmolality. So it will flow into the cell. Saline is outside, so you need both. You want to hydrate the outside and the inside. And so basically if you put sterile water in your vein, it would collapse your veins and collapse your cells. So how do you get the osmolarity up without creating that problem and still have free water? You add concentrated glucose to it. So anyway,
so
rehydration solves a lot of problems. It's basically my joints were so dehydrated. Synovial fluid is 95% water, right? It forced me to be hydrated.
So you read my mind. I was going to ask you if that was but celery has other properties like gastric motility. And I thought you were going to bring this into bile and my colleague said make sure you ask him about bile because her and I both know that you're a bile expert.
A little bit different issue there. Hydration is one thing. Gastrointestinal detoxification, of course, bile is multifunctional. Bile is the excretory waste fluid carrier of the body. And so, when I'm speaking to doctors, usually MDs, DOs, more than anything, my own naturopathic friends won't even talk to me because I've gone to the dark side because 90% of my friends are MDs and DOs and cardiologists, neurologists, oncologists, and so ones who I've antagonized over the years usually, and were mad at me, and because somebody came to see me that'd been to them and they didn't get well there, and they got well here, and then went back and said, hey, you need to open your eyes a little bit to something other than the drugs. But eventually they become my best friends. I mean, I have tons of medical doctor friends, and I just simply say, look, instead of giving the drug, try to find the problem. And so the problem in many cases is your liver, which makes bile, it carries waste out of the body, but it also, when the bile hits the small intestine, that's what emulsifies your fats.
Okay.
It also emulsifies your fatty vitamins, right? Like your alpha lipoic, your vitamin A, vitamin E, vitamin D, vitamin K. So it's multifunctional. And so, and then you look at this every day, we have like 80 million Americans that are on cholesterol meds. For what? Do you know what 85% of cholesterol that your liver makes, what it goes to make? Bile. Wow. So I want to take a drug that's going to stop the synthesis of the excretory waste fluid carrier of the body that also emulsifies my fat. So if I don't have enough bile, I'm going to be vitamin A, vitamin E, vitamin D, vitamin K, fatty acid depleted, which there's all my hormones, right? So I found understanding bile to be quite a very important thing.
I would love for you to explain the process of bile dysfunction in a person with chronic toxicity.
Okay, since bile is the excretory waste fluid, mostly lipid-soluble toxins, hormonal residents, if I have testosterone flowing through my body and it's spent, its life is up, it's got to get excreted, it has to go through the liver and has to be oxidized in phase 1, which makes it like 100 times more potent, biologically active, than before it got oxidized. So you oxidize it, then the body in the second pathway, conjugation, hooks it to an amino acid that has an opposite charge. Then it hooks to bile and it flows out, right? So bile is actually not only, I'll put it this way, what stimulates the production of bile? Fat in a meal, one thing. But, and this is not well known, but Guyton's physiology textbook changed. There was a change like a dozen years ago that said also stomach acid triggers the production of bile, right? And so probably 8 out of 10 people in America over age 30 have very, very low, and I mean low as in inadequate, not low as in pH. pH of stomach acid should be 1.5. It's actually, when it's made in the canaliculi, it's 0.5. It's diluted to 1.5 in the stomach. That triggers also the bile to flow and 6 prophylactic squeezes of the gallbladder a day. Since the gallbladder, once bile moves into the gallbladder, it's accumulating, getting ready for the next meal, right? There are pumps, sodium, potassium pumps in the gallbladder lining. It sucks the water out, concentrates the bile. And that's only supposed to happen for 4 or 5 hours. You eat a meal, squeezes, it's empty, it starts over. Well, if you don't have adequate stomach acid, then you don't get those prophylactic squeezes. And you should have a squeeze whether you eat or not, right? But over time, people are eating all this margarines and, I can't say the trade name, vegetable oils that are toxic, plastics. They're not functional fats. So in the bile ducts, they get coagulated. They become very viscous. Instead of being like water flowing, they become like cold jelly type thing where they don't flow well. So if you did eat a fatty meal after you clogged up your bile ducts, nothing flows. Or maybe you've got 100 bile ducts and 3 of them are flowing well and 20 are not. So you can't get rid of your waste hormones. You can't get rid of your metabolic waste, cellular function. So, and if you retain hormones, they don't make it to conjugation. They don't make it to excretion. They start backing up in the liver. So if you have an activated progesterone, an activated testosterone or estrogen, it's 100 times more functional or active than it was before it was for being prepared for excretion. What that does then is alter signaling. So the body says, oh, well, we've got all this estrogen here that's so toxic. We need to make more sex hormone binding globulin to accommodate it. And so it starts, your SHBG goes up, and then you have your thyroxine binding globulin, which carries your T4. Well, if there's too much oxidized thyroid, you start increasing that carrier, and et cetera, et cetera, et cetera. And so we end up, and this is a very important issue right here, because people are on cholesterol meds all the time. $400 a month, forever, ever, right? Simply because the bile is not flowing appropriately through the bile ducts. And so instead of being fluid, it's thick, where there are osmolality receptors, there are baroreceptors that feel pressure. So if you start having areas in the bile tubing that's missensing pressures, your brain says, hey, we don't have enough bile here, so what do we need more of? We need more cholesterol to synthesize more bile, because it's saying we don't have enough. We have plenty. It's just not flowing. So I've had people who had cholesterols that were 500, and we do this very well thought out, what we call a gallbladder liver cleanse, where we thin the bile out for 3 or 4 days or longer, make the bile thin again. Then we take in something like olive oil or copra sunflower oil to cause the liver to pump a bunch of bile out and the gallbladder to squeeze. But we thin the bile first. Well, then all of a sudden, boom, here it goes. 3 days later, same guy, 500 cholesterol, it's 180. 3 days later, no meds. What did I do? Fix the problem, the missampling problem. It's just like me taking an ice pack and putting on my thermostat. My heater's going to kick on. It might be 90 degrees. It's missampling, because the thickness, the viscosity, which eventually turns into little micro stones. And they're very obvious when you do a flush. We actually have people to put a colander in the toilet and collect the first 5 stools. We have them wash and flush and wash and flush and see them, put them on a plate and count them. And so when they do it again in a couple of weeks, there should be less and less and less, and that's when they know they're done, is when there's no more stones passed in the flush.
So thank you. That was a brilliant explanation. I see why you got this award now for speaking. I want to talk a little bit about some of the causes of low stomach acid. So going back to the start, and then I'd like to talk about some of the strategies for having a successful liver flush, because I know some people can struggle with them. It's not easy for everyone. So
the first one, you usually say, I will never do this again.
But wait, what's stomach acid first? Start with that.
Okay. So first, in order to produce stomach acid, there's a biological exchange that has to happen. Number one, the cell that produces stomach acid, the parietal cells, according to that big pile of gastroenterology books there, it's the most energy-dependent process in the human body.
Okay.
There are more mitochondria in the parietal cell in your stomach lining than there are probably in your heart muscle, because you have to take a positively charged hydrogen proton, which is the strictest definition of an acid, is H+, right? And it's got to be taken from your bloodstream, concentrated 1 million times into the stomach lining. So basically, it's got to go from the inside of your body to the outside of your body. Because if I pulled myself apart, I could look right through me. The gut is outside the human body. As convoluted, if I stretch myself, I could look right through me, right? Mm-hmm. So we got to pump that hydrogen proton to the outside of the body against a 3,000 to 1 concentration gradient. So think of it like this. I got 3,000 north magnets here, and I got one little bitty north magnet here. And I want to go through these 3,000. And I just got one. It's just going to keep pushing it back, right? It takes a lot of energy. I need an atomic missile hydrogen to shoot through to get to the other side. So anytime we have a low energy state, the first thing to go is stomach acid production. Wow. Number 2 is if you took all those H pluses out of your body, which are your acids, and you pump them outside the body and concentrate 1,000,000 times, you would collapse your cell membranes because you're taking cations and creating an imbalance. So textbook, biochemistry, if you're going to send an H plus this way, you send a K plus to replace it, to keep electrical neutrality during that transaction. And then 2 hours later, when the stomach is done kneading and mixing enzymes and sterilizing your food, which is the biggest reason why people have allergies, is they don't have enough stomach acid to denature the proteins. Then they are misread by your gut. So,
or parasitic infections,
we get parasitic infections because we do not have enough stomach acid to dissolve and digest and break down the cyst or the eggs. Because you can't even treat the eggs with pharmaceutical agents. You have to wait till they hatch, and then you whack them. And so that's why we have to have multiple cycles of things like mebendazole and albendazole and ivermectin.
Like the full moon cycles. That's kind of popular now.
Full moon cycles, right, because adult Ascaris worm lays 20,000 eggs a day, and they're that long. And so we see this a lot in Mexico, although there's a World Health Organization study, it's 20 years ago, said 20% of the world's population any given day has Ascaris roundworms in their intestines.
That's a really big number. I mean, 20% of the world is a very large number.
Any given day.
So yes. Do you have theories or explanations for why our energy systems are collectively so imbalanced that we are collectively having low stomach acid?
Along with the need for, so everybody's potassium deficient.
So this goes back to hydration.
Even before that, potassium. So when I say the term ATP, adenosine triphosphate, it really should be called magnesium ATP. Because you can't make ATP without magnesium. And you need the magnesium to run the old school pump the potassium into the cell. But going back further than that, where are we getting the magnesium and potassium from? From our food, right? If it was present in the food. So this goes back to a farming, a crop growing system. 100 years ago, if you pulled a carrot out of the ground, wiped it off, and ate it, there's friendly microbes on that. I mean, eating dirt was not going to bother you. Now eat some dirt with all this glyphosates in it and all the nematicides, and they've killed all the friendly flora. Just like when we take a bunch of antibiotics, we kill our flora in the cecum. In the soil, we don't have the ability or the plants can't take up the minerals unless there are microbes there to act on the rock substrates to liberate the little ions of potassium and zinc and chromium and cadmium, etc. So plants don't make minerals. They can only uptake minerals from living, healthy soil where they can liberate. They pull them up into the tomato, up into the orange. So if our food supply is messed up, because if you went back 100 years ago and you went through that, pull a carrot out of the ground, run it through, incinerate it, send it to a laboratory. You're going to have 5 magnesiums, 5 potassiums, and 1 sodium. Wild guess, okay? Because magnesium and potassium are abundant in the Earth's crust. Sodium is rare. Well, so God made your kidneys to waste that which is abundant, i.e. potassium, magnesium, zinc, etc. But those 2 mainly. And so now, if you go down to the restaurant, get a burger and fries, incinerate that, what are you going to find? Potassium, magnesium, if you found any at all. You're going to have 5 times as much sodium and 1 or 2 magnesiums if you're lucky. So now what's happening is your kidneys are wasting that which is rare, retaining that which is common, as in sodium. So what happens then? We end up with too much sodium inside the cells, and there's an old saying in physiology, water follows the concentration gradient, right?
Yeah.
So when you get too much sodium inside a cell, you don't have enough potassium and magnesium to run the pump. I'm speaking old school understanding. Then water follows a cell. You want to know what is edema? What is inflammation? That's it. The cell is full of sodium, and it swells. It's full of water. It also, you no longer have membrane potential. Remember, inside the cell, we should have 15 times more potassiums than outside. That creates a ratio issue, 50 to 1. That's why we have membrane potentials. That's why you could take a voltmeter and measure across the membrane, and it has electricity. We are electric. That's what electrolytes are. If we don't have our electrolytes, you cut my wires. I get no electricity. So we're in a low energy state.
Is that membrane dysfunction going to affect like all the receptors on the membranes as well?
Some receptors, because some are shape
dependent,
or like gates and channels are not going to work right.
Okay.
But then also, if you follow that whole chain down where people are not eating omega-3 fatty acids and 6s, the membranes don't work to begin with, right?
Hold on, before you go there, hold on, because I want to make sure that I grasped the concept you just outlined. So are you saying that chemicals like glyphosate and other pesticides are depleting our soil of beneficial microbes that allow soil to
they kill them,
that allow plants to uptake minerals from soil?
Right.
So we have minerals abundant in soil. We have microbes that facilitate plants being able to take minerals into their construction. And when you kill off these microbes, creating an imbalance in the soil, you therefore deplete the plants of minerals, therefore depleting our bodies of minerals. And then I would take it one step further and saying that the accumulation of heavy metals that we see today, really prevalent, are deranging the minerals that we do absorb, which causes further
the lack
problem.
of minerals affects the excretion of metals. There's always going to be metals.
It's feeding
But
us.
if you don't have enough magnesium, potassium to make the energy that runs the systems that normally remove daily amounts of cadmium and lead and arsenic and antimony. So our nutritional deficiency, which is extreme globally, at least in our developed nations.
So we're talking about poor stomach acid from an inability to really get enough minerals from our food, and then we're talking about further nutritional deficiencies as a result of poor absorption of food, poor bile secretion, and so on.
So one thing is that a lack of stomach acid means you are not able to ionize the minerals that are in that food.
If they are,
you have to if they were there, you have to liberate them.
Yeah.
So that you can absorb them, because they all have a charge, right?
So if I take minerals, I'm not going to fix my stomach acid necessarily? Like, what do you do?
No. Stomach acid should affect the minerals.
So are you giving patients enzymes for breaking down food? Are you giving them, what are you doing to correct?
Okay, so your pancreas makes pro-enzymes. So you have proteases and lipases and saccharide-ases. But particularly the proteins like trypsin and chemotrypsin, those are trypsinogen and chemotrypsinogen. The ogen keeps them from being active. Otherwise they digest your pancreas, right? That's what they do, is they break down proteins. So when you have your stomach acid gets up to, let's say, normal, that then helps to trigger a cascade of gastrointestinal peptides and signaling agents that say, hey, liver, make some bile. Gallbladder, squeeze. Pancreas, put out some bicarb. Put out some digestive enzymes. But when they are excreted into the small intestine, they're not active until in your villi, the little finger-like projections, on that you have the glycocalyx, and that you got these little fine hairs, and they secrete enzymes that turn the chemotrypsinogen into chemotrypsin in the right place, which is in the small bowel. So if you miss a step, you got a belly bomb instead of a meal.
So what are you doing? What is the first step with these patients?
First of all, I supplement the stomach acid.
Okay.
Because if I supplement the stomach acid, now I'm sterilizing the food. I'm liberating the nutrients. I'm making those triggers turn on that trigger off of that 1.5 pH, because we never get to the 1.58 pH. The valves don't open and close. We have an unsterile stomach. So what am I going to do? I've got yeast, bacteria, parasitic cysts in my stomach. It's warm, it's moist, it's an incubator. So if I don't have a sterile stomach and I take in a carbohydrate, I eat some corn, I eat some wheat, some barley, whatever. Now I ferment them instead of fry them. They should be fried. 1.5 pH stomach acid will kill anything, right? But if it's not present, now I'm going to ferment the stuff in my stomach. It's going to expand until there's too much pressure there, and it's going to blow open the valve, which we call the lower esophageal sphincter, or also I think known as the cardiac sphincter, because it's right next to the heart. So when that happens, they're bloating up, and this is the guy that eats a couple bowls of ice cream at watching the 10 o'clock news. 4 hours later, he's going, baby, this is the big one. Take me to the ER. I'm having a heart attack. And they go to the ER, and they look at me and say, no, it's just acid reflux, or it's
gas or something.
Gas, yeah. Because what happened is they just took in something that could ferment. Milk sugars are great. They blow up. There's only this much room between the stomach and the heart. Next thing you know, they're pushing on the heart, and it blows people up. And so it's all interconnected. Why do we have lack of stomach acid? Because one thing is potassium, magnesium, which is not in the diet. If it was in the diet, we have to liberate it from the food. With stomach acid, it's the big round. So we fix the problem for now. We take betaine hydrochloride in a capsule, a pull-apart capsule. Never take a caplet. I had a doctor friend that was partial to a particular supplement company who makes a lot of press caps. And so I said, well, how you doing now? It's been a month since you've been on the betaine. He said, oh, I'm no better. I said, what? No way, man. Show me, what brand are you getting? You getting the one that's here at this store? Oh no, I have my own brand, and I know the brand, and it's a press cap. And so I said, I want you to do me a favor, stick a colander in a toilet and wash your water over and flush and wash for a couple of days. And guess what he found? The press cap never went off. Right? And he said, okay, I got it. I will use the brand you recommend, which is the gel caps. We want them to go off in the stomach, not 10 feet down in the small intestine. It wasn't designed for that. So I will have people take one, it's a test. You got to find your dose, right? So let's say normal stomach acid's here. Maybe you're here, maybe you're here. How would we know? Well, you titrate. Because if you were here, you had too much stomach acid, you would feel uncomfortable, warm, or a burning feeling in the pit of the stomach. Not a reflux, in the pit of the stomach, usually within 20 or 30 minutes after the meal. So I'll say, take your first bite of food, take your first betaine HCl. We use a 600-ish milligram pill, fairly standard. And it's got a little pepsin in it. So if you don't feel something in 20, 30 minutes, the next meal, take 2 of them. Next meal, take 3 of them. Next meal, take 4 of them. 7 is our general maximum. If you get to 7 and you don't feel anything after the meal, it's because you are here. You have no stomach acid. So we've got to get to here, and the way we're going to find here is we go there. So you keep taking them until you feel that warm or uncomfortable feeling. Now you're here. Now we're going to back down 1. We're going to stay right there in the sweet spot. And it's not something that's going to stay static, because once you get that betaine on board, you're going to start getting the best function or the best nutrient absorption and utilization, because you're fixing a lot of stuff when you get that back. And remember, the most common cause of stomach ulcers is called Helicobacter pylori, which is an acid-resistant bacteria. They can't stand 1.5 pH, but they can stand 3. So if they can get you when you're down, they start colonizing the lining of your stomach. If they get a good colony going, then the byproduct of their metabolism is a base, an alkaline substance, ammonium hydroxide. So if you're at 3, they'll throw out some base and bring you down to where it's worse, until they start eating the lining of your stomach. So by giving the betaine HCl, finding your dose, you start killing off those H. pylori. You start digesting your food, the gas stomach, and it goes away. You get rid of a lot of your SIBO, which people call SIBO, small intestinal bowel overgrowth. Why did you get an overgrowth? Because you didn't kill the bugs that were in your food. So that's how you fix SIBO. You quit eating living bugs, and eventually that will go away.
So I would be surprised if you didn't have a pharmaceutical approach to SIBO as well. So I'm guessing that there might be techniques that you use in conjunction with HCl.
First of all, fix the P-trap.
Okay.
Stop reinfecting yourself. But we're back to bile. What is bile rich in? Bile is rich in immunoglobulins. It's also got the fluid, the lubricant, to make things slide through your intestine without having a lot of bumping and causing friction. Bile is rich in a lot of things, and so it is full of antimicrobials. So when you get your stomach acid up, you trigger your bile flow, you do your flush, get your bile flowing, SIBO takes care of itself.
Amazing. So no need for actually using exogenous killers.
No,
and I know you're a fan of sometimes giving bile. We talked about a bile product, Actigol, and Ciudad.
In Mexico, the trade name is Ursofalk. In the U.S., it's Actigol. Basically what it is the same thing that your liver produces, but it beefs up a little bit. Like you got ursodiol, you have chenodeoxycholic acid, and there's cholic acid. There's a spectrum of them. The synthetic one is the same. It's just they've got a little higher levels of a couple of those things, other than it's just like what your body makes. And so we generally have people taking, I think the standard dose that's in the textbook is like 900 milligrams a day.
And how would you compare something like that to Ciudad or one of the other bile salt products that people like?
So the difference is this is actual real deoxycholic acid, chenodeoxycholic acid, not a stimulant of your own production. Your liver makes the bile from cholesterol, right? And so if you want to stimulate more bile flow, then you can take what's called bitters, which you mentioned one, not as common as others, but the bitters, it's an old European thing. Chicory, like they put in coffee in Louisiana, that's a biostimulant. There's many of them. But if we simply thin out the bile, clear the liver and the gallbladder of their waste, sludgy bile, then you don't need to make so much bile because you'd have plenty of bile if it just had the ability to flow.
So I think that this is extremely important for, your average person to understand, and like also your typical GI, people that have complaints, but they're not necessarily in a state of severe chronic illness. But when we look at a patient who has complex chronic illness, typically we're looking at co-infections that you want to treat. And what I would like you to talk a little bit about is the steps that you take before you begin killing things like Lyme and Babesia and Bartonella, and why those are really important to prevent Herxmeyer and prevent really difficult time with treating.
Okay, so, one of the things that is so difficult with the zoonotic infections, particularly the Borrelia burgdorferi class organism.
The spirochetes.
The spirochetes, particularly Borrelia burgdorferi, which is man-made. It was designed to be stealthy. But and on its membrane, there's about 1,000 little bumps. We call them blebs in microbiology. As long as that thing is alive and spinning through your tissues, it's an irritant. But the immune system doesn't really respond well to it until you kill it. And it sheds all those blebs off. Now they're like blatantly obvious, and the immune system goes, oh my God, we've just been infected with cholera. Kill it, kill it. Well, it's already dead. But it doesn't know that, so it starts attacking, and that's the inflammatory process that happens that we describe as a gerish Herxheimer reaction that's so bad among the Lyme disease folks.
And that was part of the Th2 dominance that we had spoke about off camera, right?
Right.
Okay, just clarifying.
Yeah. Which is Th17 regulated, which is abundant in the gut, right? So our gut really, and our microflora in the gut, or a lack thereof, or an imbalance thereof, drives Th17, which causes the inability to make the Th1 and Th balance. So the longer you've had something, a chronic infection, is that Th2 gets higher, Th1 gets higher, but they won't come back. It's like having a 500-pound person on one side of the seesaw and a 50-pounder on the other. I mean, the big guy is going to stay on the bottom, right? You've got to balance it. So the gut is a huge regulatory portion of our immune system. Huge, maybe as big as any in the body is the microflora, the stomach acid production, movement of bile, excreting waste, and in this context, getting rid of the concentrated spirochetal bacterial body parts, outer surface protein A and B and C, etc. So if they accumulate in the bile ducts and in the gallbladder, remember the gallbladder concentrates bile. You see the same thing with toxoplasmosis. And you talk about people that have panic attacks. When do most panic attacks happen? It's after a lunch meal. Why would that be? Because toxins are concentrated. One of the things that's very important to understand is that gallbladder concentrates and makes opiates, what most people maybe know as metencephalins, endorphins. They're made by the lining of the gallbladder. So if I don't get that prophylactic squeeze every 4 hours and dump simple like this, let's say I've got 100 parking spots in my parking lot, and I have 100 cars to fit in each of the parking spots, everything's fine. But let's say suddenly I bring 200 cars in my parking lot, and I've only got 100 spaces. I'm going to have all kinds of mess because I can't back up. I can't get out. You're in my way. So in the gallbladder, if we over-concentrate, we have too many opiates, and in the gut, which is huge, full of opiate receptors, probably as much as the spinal canal. So I got too much opiate hitting too fewer receptors at one time, and I go, I'm crazy, and it takes a while for those to wash and dilute out. So if you happen to have toxoplasmosis, which is a protozoa or an amoeba, common among ranch and farm people,
cat owners.
Cat owners. Toxoplasmosis is a neurotoxin producer. And if you overconcentrate that neurotoxin in the gallbladder, when you get a squeeze, you go stark raving lunatic crazy, which we call schizophrenia.
Not to go on a toxoplasmosis tangent, but we could talk about cysts in the brain and treating it. And oh my God, I would love to do that, but I have to keep our time on a pace. But I want to, oh my goodness. You just blew my mind with the opioids in the gallbladder. I didn't know that. So we're talking about, when we talk about a panic attack, we're talking about like a serotonin pathway overwhelm, right? Sometimes. So you're talking about opioids, like accumulating in one area and not in another. So you have, what comes to mind is things like gut-related depression. I think about anxiety, and also just the fact that, a lot of people don't know that we produce these endogenous opioids. Like, for example, when you cry and it makes you feel better, it's because you're releasing an endogenous opioid that kills pain in your body. But in these people that have these infections, they're, like you just explained, are creating massive inflammation through the Th2 pathway primarily, and other things, and then they don't have the opioids.
Like anybody in the medical field, when you start out, they teach you physiology, and then they teach you biochemistry, and then they teach you this, so now you're a microbiologist, or you're an immunologist. Well, unless you're an immunologist and a microbiologist at the same time, and an endocrinologist, understand that the metenkephalins, the endorphins, the serotonin, the dopamine, the epinephrine, they're all come from the same place, proteins. And so if you take for instance, we've had a number of people over the years that come to the clinic with a diagnosis of Parkinson's, or let's say involuntary tremors, or dystonia. I'll need to find out, because we do microbiology and endocrinology and toxicology, to understand that there is enzymes that are created by a host of bacterial infections, particularly like staph and strep, and some of the tuberculosis, mycobacterium. They produce an enzyme inhibitor that inhibits serotonin conversion to dopamine. And I remember it's 7-hydroxytryptophan or something like that. But there's a pathway that's blocked in the production of catecholamines, and also in the sex steroid hormone category, simply because you have this infection. It screws up your dopamine, serotonin, or norepinephrine to epinephrine. So back to the big zoonotic infections, they can induce emotional disorders, and then if you don't clear those toxins, because your liver's full of sludged up bile, you then mess up your carrier hormones. And so I try to keep it simple.
No, I don't believe that.
I did try to keep it simple.
But
I didn't say, fix the gut. Take your stomach acid, find your dose.
But you just basically explained why people with parasitic infections, gut infections, Lyme, have chronic pain. I mean, you just explained it, and you took out the inflammatory. I mean, even without the inflammatory piece, you explained why the pain persists and why it can be so hard to treat.
Take pain in the bowel. There are no pain receptors in the GI tract. So why do people have pain? There's no pain receptors, but there are stretch receptors. And in our San Angelo office, we have a colonic machine. 9 out of 10 people that come in that have low back pain. An hour after, when they leave an hour later, they have no back pain. Why is that? Because they're so constipated. Instead of having there should be a stool, a space, a stool and a space corresponding with a food, bolus, and an elimination. Well, they're not. They're all packed together. They got about 100 stools in there. And that puts pressure on the lower back at the rectum, and it stretches it, and it's where is the bowel anchored? Connective tissue to the lower spine, right, into the back. So as that constipation builds pressure, it stretches and pulls on those tendons and induces inferred pain. So we have people who come and do a colonic, and they're in terrible agony, and they're depressed.
For mechanisms you just
7 out of 10
described.
people
Yeah.
come in depressed, do
Yep.
a colonic, wash everything out of the colon, all of a sudden they go like, how's this possible? I've been on psych meds for 15 years and I do a colonic and I've never been so happy.
But of course, it's not fixing the root cause, which is probably stomach acid, low stomach
Exactly.
acid. Okay.
Like sometimes we have to
Yeah.
fix the immediate issue
Yeah,
that's
of
making
course.
people depressed. They can't, if they don't sleep, which is the same thing, they come in, they do a colonic, and then they go, my God, I slept like a baby last night. Well, because you are not toxic now, and you're not agitating and irritating all your neurons all night.
So I think we have beat the GI to death and pathogens, but pun intended. I know you're doing a lot of really interesting work with cancer, and also you apply some of these therapies. Some of these cancer therapies you apply to infection as well. You were talking to me about them
Yes.
off camera. Would you like to elaborate?
In Mexico, anywhere, our MO is, and we're not always successful, but our MO is try to find the reason for the issue, whether it's multiple sclerosis symptom or an ALS symptom or a malignancy.
Mm-hmm.
Like for instance, it's in the literature. There are certain lymphomas, like Burkitt's lymphoma.
Mm-hmm.
It's in the literature. It's caused by Epstein-Barr virus. Well, that doesn't mean Epstein-Barr virus isn't associated with all these other ones. Mm-hmm. It's just nobody did the study. Mm-hmm. Who cares? Who's going to make money on somebody spending $600 million doing a study of a bunch of people with a particular cancer? No, that doesn't sell chemotherapy. All right? So we have just over many, many years, and there's a group of us that all hang out together at conferences, like some people in the room, and we talk about these things and say, yeah, I had a case of that. In fact, I know a particular guy that we had a case of Chagas disease, elephantitis, right there, came in from San Antonio. And it's very common now among the border because some of my Arizona colleagues have seen the same thing, because that is a protozoa that's transmitted by a kissing bug, which we've had forever along the border. They just didn't used to carry that protozoa. Now that bug is coming up from the interior of Guatemala and Central America.
Are you talking about mono?
No.
Oh.
Now I'm talking about elephantitis.
No, but what is the kissing bug?
No, not humans kissing.
Oh, sorry.
This is a bug that they call
Okay,
the kissing bug because
I
they
see.
are found
I see.
kissing.
Oh, goodness.
I can't remember the name of the bug.
It's okay. So you're
But
saying,
anyway,
yeah.
So there's an insect that carries a protozoa that bites you on the foot, injects you with this protozoa that turns into worms. And the worms proliferate and they block your lymph system until your legs look like elephants. Look up elephantitis. That's caused by that bug. So we have to keep looking at why, even though nobody's ever made that association before. I mean, we make associations all the time after we see a pattern. And we have really good testing now for the zoonotic infections, which we didn't always have. So now we can say, hey, that's weird. I've had 90% of our people show up in Mexico with cancer that have off the charts Epstein-Barr virus. Okay. You can also say 90% of them also have a Borrelia class organism. And 85 to 90% of them have obstructive sleep apnea. All in one group,
Right, so they have airway challenges, and we could get into the chicken and egg of airway challenges, but and potentially recent viruses can play a role in cancer too. We'll just could leave it at that. Is that accurate? Okay. All right. So you're doing really interesting things with ex vivo, like microbiology with cancer, aren't you? Aren't you taking cancer cells and doing, or not you specifically, but your clinic?
We use labs outside the country. I mean, we send blood off to Greece and some other countries like South Korea that do a much more involved study.
Okay.
So they will extract circulating cancer cells, basically do a whole genome of that person's cancer cells. And then they will take those cancer cells and put them in. They grow them up. They make trillions of them. Mm-hmm. They have a big media that clones them. And so they can use those to find out, at least outside the human body, it is the person's cancer cells cloned. So they have the same genetics and the, Ki67 genes or P53 genes mutated. And so if they clone them, they're going to still be that same way. And then they put them in petri dishes with some vitamin C, some mushroom extract, some chemotherapy, et cetera, et cetera. They test all of it. I mean, they have no axe to grind, natural or pharmaceutical. And then it will say, okay, this has a 55%, where this chemo has none, and this chemo is 80%. This vitamin C came up at 50%, or artesunate, or curcumin.
Okay.
So it gives us a direction therapeutically, so we're not just burning people's money and burning daylight, because these people, most of the people that come to us, have already failed standard of care. They've been chemo, they've done radiation, they've done surgery, they've done bone marrow stem cells. So we don't have a lot of time we got to make every moment count.
Is the therapy, you just described the SOT therapy?
We also do SOT therapy. We do that for infections more.
Okay.
So because an SOT for cancer, not everybody fits that, because SOT, when it works really well. And so if you've got a 7-centimeter primary lung mass with all kind of blood supply to it, it could start falling apart in 2 weeks. And nobody can get inside the lung quick enough before they all of a sudden, like the kid pulling his finger out of the dike, I mean, boom, you're going to bleed into the lung. So you need controlled tumors, not much blood supply. Like in a breast, you're not going to bleed to death because you killed a 1-centimeter tumor there. In the liver, that's kind of the end of the road, so you can get away with a centimeter, but you can't do it with a mets to the brain. It's a very difficult thing to navigate and in the lungs. So.
Okay, so wow, thank you. So just to finish up, I know I wish we had 2 hours, but we'll just finish up. I'd like to just talk a little bit about infection again, because we're seeing such prevalence of, these spirochete infections and viruses today. So I'd like to know, is there a specific order that you like to go after pathogens versus viruses or parasites, and why? And can you talk a little bit clinically about?
In Mexico, we have an abundance of very inexpensive parasite medicines.
Okay.
So for $5 versus the same pill in Mexico that's $1 is $200 a pill in the U.S. So
Albendazole?
Mebendazole.
Mebendazole, okay.
Yeah, and there's many trade names of that, but we tend to use the Mebendazole's not a big systemic. It's more works in the gut. And so if we suspect somebody has gut problems, well, that's like 8 out of 10 people, right? We'll give them Mebendazole and do that. We do it 3 days on, off for a month, 3 days on, off for a month. We do like 3 or 4 cycles of it, just kind of routine, because then, depending on, we have them look at their stool and put a colander in their toilet, because a lot of times you can't see the worms until they're dead and they quit crawling. And then we look at their labs and we see, do they have high eosinophils and high monocytes? And do they have an accompanying GI tract issues? So we then decide from that, do we want to do a systemic treatment? Because a lot of the people in the zoonotic world, particularly in the Lyme world, they realize, as we do, that you can get a lot of spirochetes in a 10-inch worm in your bowel. So the worm can harbor infections. So if you don't get rid of those parasites first, then you're kind of shooting yourself in the foot.
And then I think about also toxic bile that has heavy metals, or other types of chemicals that are inside the parasites. So you're killing the parasites, and then you have to kind of play cleanup too with the whatever they're holding. And that sounds like a process. And then you decide to go after the spirochetes later, or the viruses, or what do you go after next?
We generally hit the parasites first, but that's a no-brainer. Here's 2 pills, take it for 3 days.
Okay.
So that's off the plate. We know that if they had a belly full of ascaris worms or hookworms, there's a lot of different type of medicines for different parasites, like tapeworms and liver flukes. You're not going to kill that with mebendazole. We have to decide, do the numbers add up? We do have really good labs for GI in Mexico because they tend to know more about parasites, because an MD in America does not have to take parasitology to get him to pass his exam. It's an elective. Only in America. Anywhere else in the world, you are not going to get a medical degree unless you take parasitology. So we see people with allergies all the time. And so if you see somebody with a lot of allergies and you look at the biochemical markers, they'll just say, oh, well, you got allergies. Well, yeah, but they got parasites, which are making them really toxic and messing with their bowel lining, which makes them leak into the body, which makes them toxic, which makes them have allergies. So Western medicine says take some antihistamine.
Right.
Eastern medicine says kill the parasite and you won't need the antihistamine.
So, all right. So you take care of parasites, and then just to finish, when you go after, because you mentioned off camera that when someone has Lyme and co-infections like Babesia, Bartonella, that you have to clear those first. And I just wanted to.
Generally, we save the Borrelia burgdorferi for last.
And why?
Yeah, we have much debate about this among all the practices of clinics that do this. Borrelia burgdorferi inhibits natural killer cell activity in cytotoxic T cells.
Okay.
Now, how does the body immune system kill a virus in the body?
NK cells.
It has to kill the cell that the virus is in, because the immune system can't say, hey, open up, let me in there. No, it's bigger than the cell, right? So although some say it can spray the cell with peroxide, possibly that can go into the membrane, but I don't think so. I think essentially the T cells have to kill the virally infected cells. And so if somebody's immune suppressed, their T cells are down, and they also have, let's say, Epstein-Barr virus or cytomegalovirus or HHV6, et cetera, et cetera. If we see a really high titer of EBV, which is another complicating factor, because we also find these in our chronically ill people, 95% really have high top reference range, 750 and up. Could be 3,000, but the measuring is they stop at 750. So Epstein-Barr is an interesting virus. All viruses must have access to a cell, and they got to take over some of your cellular machining, like the Golgi apparatus or whatever. EBV lives in your mitochondria. And so the new cancer buzz, at least in the more integrative holistic world, and even just standard of care, is saying it is an energy deficiency disease, a mitochondrial disease. Well, if EBV proliferates inside your mitochondria till it swells and ruptures, and what's the hallmark of EBV? You're tired. If I'm tired, my cells are tired.
Low stomach
my
acid.
immune cells are tired, right?
Yeah.
It affects everything.
Yeah.
So we make a clinical decision after we've tolerance tested people and get to know how do they respond to other treatments for the particular issue, because we don't like to give people something that all of a sudden their T cells come up and they've got EBV. Now their immune system's going to attack every cell in their body that's got EBV. They could be down for 3 months. Could be sick as a dog. And ask me how we learned that. Not in a pleasant way.
Well, I'm wondering if it has to do with natural killer cell transplant, which is a therapy I've been very interested in. But
so what's happening is if we if we don't treat the EBV first, if we treat the Borrelia first, the T cells are going to come up and start attacking all the cells that have EBV instead, and they're going to feel terrible. So we try to bring the EBV levels down to a minimum.
Okay.
So then when we kill off the Borrelia burgdorferi, and the T cells come up, then they're not going to have that many cells to attack. So we don't like people to feel bad because they get mad at me.
You're making it very hard to end the interview because I have to ask you. All right, as a last note, do you have any simple tips for EBV treatment to start?
There is a program that we kind of adapted from a mononucleosis study that was done by Dana Fabian, I think. Anyway, she's a researcher, a really smart gal. And she used selenium, vitamin C. We use NAC because we want to make... You need glutathione to kill viruses.
Okay.
Minimize arginine-rich foods. Upscale lysine-rich food because lysine competes with arginine.
Okay.
And particularly the herpes family loves arginine. And then licorice root extract, which is very, very much cranks up the interferon, which is very antiviral.
Wow. Okay. I've heard about that for adrenals, but not for
we've had
virus.
the only thing about, from a botanical standpoint, and we caution anyone that goes on licorice root extract, is that the glyceric acid mimics aldosterone hormone. In some people that are very sensitive, it can cause their blood pressure to go up because that's aldosterone affects water balance and potassium. Right.
Okay.
So if you just, we just tell everybody, if you're going to take licorice root extract, watch your blood pressure. And if it starts going up, you better stop it. Make sure your practitioner, your doctor, nurse prac, whoever knows you're doing that, especially if you're hypertensive to begin with.
Yeah.
Or if you're on blood pressure meds.
Yeah, or dehydrate, all the things.
Yes,
wow. Dr. Hines,
it's very simple.
Goodness, this has been so phenomenal, and I'm so grateful to talk to you about all these topics. Thank you so much.
You're welcome very
where
much.
can people find you if they want to come to?
HopeWellness.com or HopeWellnessCenter.com. One is Mexico site, one is U.S. site. But all of that stuff goes on in Mexico.
Right, you're not treating anyone.
Consult here just to see really, do they need to go to Mexico for the big guns, or is it just
they just need a colonic
diet or a colonic?
Okay,
simple Simon stuff.
Thank you so much. I'm so grateful, and we're going to be shadowing you at the clinic here in Mexico for the next couple of days and get some good footage. So we'll be posting that too. Thank you so much for joining us.